Hello, I'm Dr. Michael Dent, CEO of HealthLynked. First off, I want to thank everyone that has downloaded our COVID-19 tracker app from the Apple Store. Our team continues to work hard to make sure people around the world have the most up-to-date and accurate information on COVID-19. Our commitment to HealthLynked is to connect doctors, patients, and their healthcare data from around the world and to improve healthcare through the efficient exchange of medical information and connectivity. HealthLynked is the first global healthcare network with over 4 million users. As more patients look to us to connect to the healthcare providers they choose as a resource for their medical information and a secure place to keep their medical records, we are committed to improve healthcare for everyone. HealthLynked was founded by healthcare providers dedicated to patient care, and you can be assured we do not share patient information. We look to empower our patient members and provide them the resources, tools, technology, and guidance to stay healthy and to get the best medical care possible for themselves and all their family members. 1 month ago, we launched HealthLynked University to provide medical education to healthcare providers and our patient members. In keeping with this mission, we developed a partnership with MedCram, an online medical education resource, and Dr. Roger Schwell. There are over 150 educational videos and podcasts at HealthLynked University that are free to our users. Topics covered in our educational library include hypertension, diabetes, COVID-19, functional medicine, women's health, asthma, and many more. We will continually update our medical educational materials over the months and years to come. You can view this content by clicking the link on our main website, healthlynked.com, or go directly to HealthLynked University. There's a lot of confusing information on how to protect oneself from COVID-19 infection, which tests are accurate, and how you know if you've been exposed to COVID-19. Dr. Schwell is a critical care specialist and has been following the COVID-19 pandemic from the beginning. He's an expert in understanding the infection and its implications for both short-term and long-term. I am now proud to introduce Roger Schwell, who will be reviewing the latest information on COVID-19 and how best to protect you and your family.
Thanks, Michael. Hi, this is Dr. Roger Seheult from medcram.com. I'm a board-certified pulmonary critical care specialist, and I've been taking care of COVID-19 patients in the intensive care unit. We're enthusiastic about our partnership with HealthLynked. Medcram.com and the Medcram YouTube channel have been a reliable source of unbiased information regarding the coronavirus pandemic. As you may know, the SARS-CoV-2 virus infects primarily your lungs, throat, and GI tract. Recent evidence seems to indicate that symptoms begin with fever first, then cough, and then on to muscle pain. This is in contradistinction to the influenza virus, which often begins with cough first, then fever, although COVID-19 can present in a number of different ways. Typically, the incubation period is anywhere between 0 and 5 days, with symptoms lasting anywhere between 7 to 10 days. In the minority of cases, patients end up in the hospital because they're not getting better, and that's where I see them. There are certain risk factors which increases your chance of ending up in the hospital. Risk factors such as age, body mass index, cardiovascular disease, kidney disease, and certain types of lung diseases. There also seems to be emerging evidence about your immune system and the role of T and B cells. And of course, this plays into whether or not a vaccine is going to be effective. In terms of these different phases of the infection, there is an asymptomatic period where the virus is incubated, and then approximately 7-day period where there are symptoms. It's during this time that you could potentially spread the virus. There's also emerging evidence that wearing masks not only reduces the transmission of the virus, but may also protect the wearer by reducing the amount of viral particles that the wearer could receive and potentially increasing the chances of the wearer of the mask having a more asymptomatic course. On one of our recent updates on medcram.com and on the YouTube channel, we compared the characteristics of the different COVID-19 tests that are possible. And there are two basic groups. One are the paper antigen tests, and the other one is the reverse transcriptase PCR tests, which are the ones that are currently being used, known as amplification tests. We believe there's a lot of merit in looking into the paper antigen tests because they're very cheap, they're very rapid, they can be done at home, and they're rapidly scalable. And many proponents believe that these tests are sensitive enough to detect the vast majority of infectious COVID-19 patients. On some of our recent updates, we talked to Dr. Bobby Brooke Herrera, co-founder and CEO of E25 Bio, who makes these tests, and also Dr. Michael Minna, who is a Harvard professor in the School of Public Health and in the medical school, who also advocates for these paper tests. This may be the key to opening up our schools and also our economy. But I'd like to encourage you to come to our website, medcram.com, to see not only COVID-19 updates, but also medical updates in just about every category. Many of them are free. Some of them also give continuing medical education credit. Once again, from me and the rest of the team here at MedCram, welcome to HealthLynked.